ABC 7 News at 5.
Health news tonight. A growing number of aging athletes and weekend warriors are facing the flip side of playing sports into middle age, worn out and damaged knees. The outcome is often an artificial knee replacement. But as ABC 7's health and science reporter Carolyn Johnson explains, a surgeon here in the Bay Area is offering an alternative.
Just played basketball constantly.
Jodi Lom's college basketball career left her with more than memories. It left her with the scars from multiple knee surgeries and the prospect of a total knee replacement while still in her 30s.
Couldn't do anything. I was bone on bone, and I could barely walk.
But instead of an artificial joint, a Bay Area surgeon rebuilt Jodi's knee by combining several procedures into a single surgery to achieve what he calls a biological knee replacement.
There are two types of cartilage in the knee. First is the articular cartilage. This is the covering of the bone. When you get arthritis, it's wearing down of this articular cartilage to the bone.
Dr. Kevin Stone runs a private orthopedic clinic in San Francisco. He started by removing bone matter from deep in the hollow area inside Jodi's knee and grinding it into a paste.
So we take that paste, bloody the arthritic area of the knee, and pack the paste back on. That paste has the patient's own stem cells, and we can stimulate that to regrow new articular cartilage.
Next, and perhaps more challenging, Stone also replaced Jodi's meniscus, the pad-like cartilage that acts as a shock absorber. The surgical transplant with a cadaver meniscus again involves stimulating the blood supply in the joint.
So it's a natural meniscus that your body then grows cells back into, and so it becomes your tissue really within 6 weeks.
With rehabilitation, he says patients treated with his combination technique are often able to continue participating in sports potentially for years to come, though most, he says, will eventually require a traditional knee replacement down the road. But some surgeons have doubts about whether combining several techniques into a single surgery is really producing measurably better results.
There are really not any significantly large long-term follow-ups on meniscus transplants.
Dr. James Garrick is an orthopedic surgeon at St. Francis Medical Center. He believes less invasive microfracture surgery could produce nearly the same relief.
I'm not sure I believe in the more is better thing. And trying to get from 85 to 90% better results is very difficult. It's difficult to document, and it's difficult to do.
But Dr. Stone points to his own follow-up studies that show a high percentage of patients reporting continued pain relief and increased range of motion years later. Jodi Lom is among the believers.
2 years ago, I did a triathlon. And now I swim and do spin classes and play with my kids. So yes, it's been highly successful for me.
In San Francisco, Carolyn Johnson, ABC 7 News.
Now, Dr. Stone says the biological knee repair that you saw there is generally less expensive because it's done as an outpatient procedure. The average cost is between $10,000 to $20,000 compared to $20,000 and up for an artificial total knee replacement, which, as you heard in that report, many people will often need anyway.